So let's talk about the difference of atherosclerosis versus arteriosclerosis, and part of the reason why high blood pressure occurs with increasing age. Of course, last class we talked about atherosclerosis. So that's the buildup of the fatty streaks and the fibromuscular plaque that leads to heart disease. And of course, injury to the endothelium. And we talked about in last class, one of the things that causes injury to the endothelium is high blood pressure. So that does damage the endothelium in and of itself. And then we have arteriosclerosis, which is a progressive stiffening and hardening, loss of elasticity in the arteries that occurs with aging. So your arteries become more stiff as you get older, and so that causes blood pressure to rise. So if you think about it, when you go to a home improvement store like Lowe's or Home Depot, you could buy different types of garden hoses. You can buy garden hoses that are very flexible, and then you can buy garden hoses that are very stiff and rigid. So when we're younger, we are more like the flexible garden hose, and as we get older, we become more like that rigid garden hose. So both of these are related to hypertension, and that hypertension can accelerate the atherosclerotic process. And then arteriosclerosis, the stiffening, causes blood pressure to increase with age. One of the consequences of high blood pressure is stroke. So a very serious illness. A lot of you who want to work in physical and occupational therapy, you are probably going to work with people who've had strokes. So if you look at younger ages, you can see the incidence is very low, but it's not non-existent. So young people can have strokes. Also look at ages 40 to 59, where more women have more strokes than men. And then as they get older, it kind of evens out a little bit. But just like everything else, the prevalence goes up quite dramatically as someone gets older. So let's talk a little bit about the characteristics of hypertension. So why do people have hypertension? There really is no known cause for most people, and that's called idiopathic or primary or essential hypertension. It's just something that comes on because of age. Secondary hypertension is a result of some other diseases, and we've got a slide for that, a couple down. So some other disease causes hypertension in and of itself. And of course, there are genetic environmental factors. We talked on one of the previous slides that there's a 90% probability of developing hypertension throughout the lifetime. So that's, a pretty good risk. Twice the risk for people who are already in the pre-hypertension stages. So if you are already pre-hypertensive, the chances are pretty good it's going to progress to hypertension without some sort of intervention. Interestingly, that family history plays a large role in developing hypertension. So if you have a strong family history of hypertension, you definitely want to get regular blood pressure checks, even if you're a younger person. You may eventually need to take medication, and of course with a 90% probability, a lot of people are going to probably need some medication, but you would probably want to wait until you are, 60 versus 30 to take high blood pressure medication. Let's look at the secondary causes of hypertension. So it's kind of interesting, some of these we've already talked about a little bit. Sleep apnea. So sleep apnea, very serious illness. So people who have sleep apnea tend to have hypertension. So the whole role of sleep science is an emerging field. Other medications can cause hypertension, kidney disease especially. If a person has chronic kidney disease, they will typically develop hypertension. Other metabolic disorders, such as they've got high aldosterone, steroid therapy, people who take a lot of corticosteroids, prednisone, pheochromocytomia, that's high iron, people who have coarctation of the aorta. So children, we talked about congenital heart diseases. So they can have high blood pressure in their upper extremity if they have a coarctation. And thyroid or parathyroid disease, particularly hyper conditions of thyroid and parathyroid diseases. So all of these can lead to secondary hypertension. So people will develop hypertension as a result of these diseases. So let's look at the risk factors, and we've talked a little bit about these already. Again, big family history, increasing age, talked about the role of smoking, of course, increased body weight, BMI. Sodium plays a role with some people. Not everybody is sodium sensitive, but for a lot of people, particularly African Americans, they tend to have a hypertension that is largely affected by sodium. So 2,400 milligrams a day is recommended. And so average sodium intake, maybe 3,500, 4,000 a day. And we'll talk about recommendations for sodium intake. Low physical activity, more men versus women, and as I mentioned previously, African Americans have higher risk than other races.